More on the Sputnik vaccine. We're now joined by Stuart Smith from Moscow, our correspondent there. Very warm welcome to you. Thank you very much for joining us. All right, so our Health Minister, Dr. Zweli Mkhize, has confirmed that authorities are at an advanced stage of evaluating the Sputnik V COVID vaccine. I'm sure from your side you can share more information about Sputnik V and how really it's been received in Russia by Russians.
Well, Russia gained a lot of global respect last week when it turned out in the Lancet journal some results were published, a very prestigious medical journal in the UK, that confirmed its efficacy and safety is indeed around 92%, which the makers had always said, but a lot of doubt had been cast on this because Russia had only published trial data from phase 1 and phase 2 trials. This latest phase 3 trial data from last week shows that it is indeed very effective vaccine, and as we've seen in the rollout in Russia, it is a reasonably safe vaccine with only the mild side effects which most vaccines usually come with, such as headaches and fatigue for a short while. No major side effects. However, when it comes to the new variant, which is of course what everyone is concerned about, the 501v2 variant, right now there is no data on whether this vaccine is any less or any more effective against 501v2 variant. Its makers, the Gamaleya Institute, who fund the vaccination of Sputnik V and in joint partnership with the government, its makers are working on this right now. Potentially will have results for the South African Health Ministry within a few days. However, we are at the brink of what we currently know about this, and Sputnik V, as things stand, is as unknown as all the other vaccines out there.
Yeah, and I wonder if you know the authorities that side and pharmaceutical companies that side are aware of just how pessimistic South Africans are at the moment. I mean, we recently had the arrival of the AstraZeneca vaccine coming up from India, which wasn't very effective to the new variant discovered in South Africa. Is that being factored into? Is there any sort of communication? I know you're saying that you know the pharmaceutical companies are working on that and working on whether they can give us any confirmations or guarantees regarding the Sputnik V. But what are you hearing? I mean, in terms of whether they are aware that South Africans are at this point quite pessimistic?
Yeah, they certainly are very aware, and in fact Sputnik V and the makers of the Sputnik V vaccine, the Gamaleya Institute, they prefer to work on a bilateral basis, not go through other agencies, partly because of this reason that it allows them to find out exactly what the concerns are, what the logistical challenges are for each country. Sputnik V has been rolled out to a few dozen countries so far on different continents around the world, particularly South America, but also some in Africa, and Guinea, Tunisia and Algeria have all registered the vaccine as safe, and the rollout is going on in Guinea and Algeria with this vaccine. However, it is indeed up to individual member states to suggest what they may need from the vaccines. In some cases, it's better logistics than, say, the American ones, with a cheaper price tag, or its ability to be stored within +2 to +8 degrees Celsius. They are, of course, now looking as well at also, can this vaccine deal with particular variants in particular countries?
Yeah, you know, you spoke to me about the Lancet journal, where you know Sputnik V has been applauded internationally. I really want to focus on Russia specifically, and I want to focus on Russians who've perhaps taken the Sputnik V vaccine and how they've responded to it and what they're saying about the Sputnik V vaccine. And the reason I ask that is just because, you know, if you're sending a vaccine from a country to another, I'd like to know how your country's doing with that vaccine, which is a similar question I in fact did have for the AstraZeneca vaccine when it was coming from India. So I'll pose that question to you then in terms of how people have essentially responded in Russia specifically to Sputnik V.
In Russia, it is the only vaccine available. The rollout began, on the face of it, in August last year. It was the vaccine to be first registered in the world. However, its rollout has been very poor compared to many other countries. Officially, about 2 million doses produced. Officially, about 1 million of those given in Russia. However, the figures very rarely are updated and very rarely are public, and there's a lot of question marks over whether that 1 million figure is really correct. Some estimates estimate, some independent epidemiologists estimate it could be more in the hundreds of thousands, which would be less than 1% of Russia's entire population. Russia, as it started its vaccination rollout, had a huge problem with manufacturing capacity. It did not have the facilities available to manufacture a vaccine like this at such scale. The problem now seems to be vaccine mistrust, which is high in Europe anyway, but beats most European countries, even ones like France, with only about 40% of people saying they're willing to take the vaccine. So the limiting factor here in Russia seems to be a concern about the safety of the vaccine itself.
I mean, this is probably a question for our own health minister here, but I'll ask you in case maybe you've heard anything. But is there sort of a time frame or anything that you're hearing about when we could possibly start to see the Sputnik V vaccine landing in South African soil? I mean, we have been talking about the fact that, there's still some work needs to be done and some certain guarantees that need to be given to the South African government. But what are you hearing in terms of that time frame?
Well, Russia says it has the vaccine doses ready to go. It has a few manufacturing plants around the world, Iran, Brazil, China, Korea, and says it has the numbers ready to go. It'll be a question of negotiating exactly how many are required and the cost of that. Russia is not just looking at bilateral agreements with countries, it's also working on the European Union and also the World Health Organization. The World Health Organization has not yet registered this vaccine under its emergency use authorization, which means it's not available at the moment through COVAX, which is, of course, one of the other methods that vaccines are being distributed around the world. So currently, negotiations are purely between the South African government and the makers of this vaccine, the Russian Direct Investment Fund. But no details on when exactly this will be agreed and sorted out.
All right, Stuart, thank you so very much for that information. Much appreciated. Thank you.